This is Florida Gulf Coast University.
As the baby boom generation ages, the need for healthcare and healthcare professionals increases. In many U.S. communities, that need might go unmet. Not so, however, in areas like ours, where a growing university provides training and education for nurses, physical and occupational therapists, and community health professionals. Find out more about meeting the need for healthcare on this edition of FGCU Perspectives. Our guests today: Mitchell Cordova, Dean of the College of Health Professions at Florida Gulf Coast University; and Nolan, the Interim Director of FGCU's School of Nursing; Sharon Bevins, Chair of the Department of Physical Therapy and Human Performance; and Linda Martin, Chair and Program Director of the Department of Occupational Therapy and Community Health. Mitch, let's start with you. Is that a fair assessment that an aging population brings with it a need for more healthcare and healthcare professionals?
Yes, absolutely. As we know, the baby boomer generation is aging and of course is putting a great demand on the healthcare system. At FGCU, in our college particularly, we're being very responsive to those needs, whether it's in nursing, whether it's in physical therapy, whether it's in occupational therapy or other majors within our college. We absolutely have to be responsive to the aging population and produce and generate quality graduates that can meet those community healthcare needs. And
we talked about the aging population. Is the existing healthcare worker population aging as well?
Oh, absolutely. One of the biggest problems that we have facing the discipline of nursing right now is that nurses are aging, and nursing faculty are aging. And so therefore, we have to create a new supply of nurses to meet the healthcare needs within the community, but also of nurses who can be faculty members.
Sharon, are there certain areas of healthcare more in demand as a population ages?
In my area, in physical therapy and human performance, we see need across the lifespan. We see need for athletic trainers and exercise scientists and physical therapists to provide not only what we think of as rehabilitation kind of medicine, but a lot of information to the public about health and wellness and prevention of injuries and prevention of disease. And that's probably our biggest growth area in our disciplines.
Linda, how does community health factor into a discussion like this?
Well, community health is a broad area, and it means a lot of different things to different people. But people in community health, in fact, all of our disciplines have specialty practice in the community. There's community practice in nursing and in physical therapy as well as occupational therapy. So the term community health can be interpreted a lot of different ways depending on your lens. We have an undergraduate degree, a Bachelor of Science in Community Health, which prepares students for a number of things. They have pre-graduate school track, for occupational therapy or perhaps public health, as well as baccalaureate degrees that could prepare them to be health educators, which, with all the lifestyle related conditions out there, health educators are increasingly important and in demand. Also, for workers in your local community health agency that deals with a particular client population, and so we have practicum experiences so students can go out there and get some job preparation at that level as well.
Mitch, if there's a need for more healthcare professionals, how do you go about meeting that? What do you do?
Well, we partner with the community in various task force and workforce development groups within the community in the 5-county area, and we work hard in identifying and working with those different committees or task forces in understanding from the employers, from the healthcare providers, the health systems, what their needs are. So whether it's more BSN nurses, or whether they need more physical therapists or occupational therapists, athletic trainers, for example, if particularly certain school districts. we talk about what their needs are, and we work hard to try to increase our class sizes, increase our cohort sizes to meet the demands that the community tells us they need.
Do those needs change from a nursing perspective? Do you see a shift in the kinds of nurses that are needed over time?
Well, I absolutely. I mean, I think at this point in time within this surrounding community, there's a critical need for baccalaureate prepared nurses and advanced practice nurses, which are prepared at the master's and both the doctoral level. Those are the areas where we really have a definite shortage of nurses working within the various healthcare systems and out in the community.
Sharon, you talked about the fact that it was across age groups. Do you see those needs increasing in other age groups other than an aging population?
I think Florida is unique in that we do have perhaps a higher percentage of the aging population than other parts of the country, but what many people may not be aware of is that a lot of very healthy older adults move to Florida to maintain an active lifestyle. So when we think of working with that increasing aging population, we also need to think about how to keep them well, how to keep them active, how to keep them healthy. That population is certainly growing. And there were statistics a while ago that children under 6 were also a quite rapidly growing segment of the population in Florida. So we can't forget the rest of the lifespan, but clearly the needs of older individuals in Florida are a priority for us.
Now, all of you are working in a new facility. This is the first year that you've been in a new hall. Tell us about the opportunities that presents.
Yeah, well, the college is fortunate to move into Merritt Hall in January, and really the biggest opportunity is the new environment with which our faculty and our students get to teach and learn. We went from a previous facility that did as well as we started out as a college to a new facility that has the latest, greatest information technology, instructional equipment, dynamic classroom environment, dynamic laboratory environments, and so now we finally, I think, have that piece of the missing puzzle that we've needed to support such fast-growing programs in the college. Our facilities are phenomenal, and they will allow the faculty to truly unleash themselves in teaching the latest, greatest advances in the discipline without being constrained to older equipment or a facility that wasn't matched to the rapidly growing demands that health education and all of our disciplines require.
Linda, how's that showing up for your department?
Well, we have a wonderful expansion. We have a new independent living lab and a separate practice lab, as well as a new simulator lab. We have obtained a driving simulator and a work simulator, and so this is all very exciting for us. And the biggest thing it provides is that it allows us to grow the program and take in more students. There's a huge demand right now for occupational therapy program, by student demand. And it's driven by the demand of Florida and the country for occupational therapists, as well as other healthcare professionals. But it allows us to grow that program and provide educational opportunities for more students, and we were able to take in the past. So it really is a wonderful new facility, and we're very proud of it.
Sharon, same for you, the opportunities and options?
Yes, as Dean Cordova said, we shared our spaces very well in our previous facility, but the ability to have multiple labs going at one time and not having schedule of lab drive what you can do when has been just a real luxury for us this semester. We are able to increase our cohort sizes of our students that we can admit because there's more lab space, and it's given us a lot more freedom to work with students in the way that we would like to, with the equipment that they're likely to come in contact with out in the community, which means up-to-date equipment that they need to learn how to use. And with the opening of this new building, we really have that. We're very grateful for the new facilities.
I don't know, as somebody who's not schooled in your area, I don't know that simulators would have come to my mind, but that's apparently a very big thing in education.
It is. The human simulators that we have now in Marib Hall that the nursing students are using provide the opportunity for the development of critical thinking skills. They also provide the development skills needed for learning things like intramuscular injections or placement of invasive lines. It depends on the level of the student with respect to what they learn using a simulator. There are many, many case scenarios that we have that we can actually download from an internet source onto the various simulators, and they can take the students through a whole simulation that's designed to be just like something they would experience in a hospital setting. And the student will be in there by themselves. The rest of the group will be in a demonstration room, if you like. They can see what's going on in the simulation room, and they can hear everything. The student that's working through the simulation has to think, respond, act, do everything that they would have to do if they were in a patient's room in a hospital. And then they get the benefit of having peer feedback and feedback from their instructor about things that they could have done differently.
And all this happens with accreditation.
Yeah, absolutely. Most of our programs in the college are accredited, which most instances require that we have certain pieces of equipment to be able to deliver and teach certain competencies and proficiencies. And so as an institution, as a college that's very much in line and supportive and take accreditation very seriously, that means the environment with which we provide for our faculty and students to learn and teach has to meet that. So health professions, educational programs are high tech, and so we need to have the latest advances in this equipment. And so the new facility absolutely allows us to deliver what accreditation expects us to deliver.
And you have in your professions, it's not only a degree program, but also licensure and certification. So in addition to getting a degree, which confirms a certain thing, there are other steps that have to be done.
Yes, there are, and that depends on the profession. What the degree allows you to do is to sit for a certification exam or a licensing exam. So what we regularly do, in fact what I was doing earlier today, was certifying students as being eligible to sit for physical therapy licensure exams in other states. So some of our students, and the majority of our students stay in Florida, but some of our students are out of state, and so we have to go through this process that allows them. Each discipline has its own kind of exam, its own passing scores, what's acceptable. We've always done well with those kinds of measures.
And this lets an employer, at a great distance, look at a candidate and say, they have this, they have this, they have this. I know this much about them.
Exactly.
Do you have statistics on how well students do towards passing the, additional to their degree, how well they pass on their board exams? And
absolutely. One of the biggest outcomes, or if you will, that we collect on programs is student success rates on passing exams. As Dr. Bevins indicated, a big part of what we do within our programs is prepare students to sit for entry-level board or entry-level licensing exams. And so, for example, within School of Nursing, and I'll let Dr. Nolan speak to this, we do have certain benchmarks that we do need to meet on those board exams.
Yeah, the benchmarks are set both nationally and by the state, and you need to meet the national benchmarks each year with each of the classes that you graduate.
This is your program.
This is for the nursing programs, both the baccalaureate nursing program and the graduate programs. At FGCU, we have 3 program majors in the graduate program: nurse anesthesia, acute care nurse practitioner, and primary health care nurse practitioner. And each of those separate majors has its own licensing credentialing examination and national benchmarks that have to be met.
I throw this out there for all of you. It's obvious that for a College of Health Professions to have an active healthcare community is a very desirable thing, that you've got places for students to get jobs and also to learn some things.
Absolutely.
But does the healthcare community gain as well from having an institution of education?
I would say yes. Well, there are a number of examples I guess I could give. Number one is when you have students out in clinicals, in agencies where they are being supervised as they learn to implement the skills that they've learned at school. At the first, it's maybe more of a burden on the supervisor, but as they end their clinical rotation, they're really functioning as pretty much a full-time therapist, and so it gives back to the agency for their contributions to the educational process. And it is something that all of our programs require, that our students get out into actual patient care delivery settings as part of their educational program. So they get that. We also conduct some of our research projects with various community agencies. And when we collect data on those, I know with some of in my own case, we deliver those data to the agency, and some community health agencies are really dependent upon grants from private foundations or state or federal agencies, and they use those data to show outcomes of programs going on, and it's valuable to them in helping them to secure grants. So we have had that experience. So there are a number of ways. That's just two.
Sharon, likewise in physical therapy?
Yes, and I think one of the real benefits to the local healthcare providers is if we place our students there, they get a chance to work with our students. And I would say that a pretty high percentage of our students are offered employment at the sites where they do their final clinical education experiences, and that's across the board. In our undergraduate program in exercise science, we have students that go to the Red Sox training camp, and we have several students now that are part of the Red Sox organization, and that's purely because we have this wonderful opportunity to place our students in that kind of facility, in addition to all the healthcare sites that we can place students in. So I think it's really mutually beneficial. Our students get a wonderful opportunity, and organizations get a chance to see our students.
Benefit from nurses in the community as well?
Yeah, I think something that the others haven't mentioned is the contribution that faculty will make within the community. And in the School of Nursing, all of the nursing faculty each have their own practice in nursing somewhere in the community, whether they're working as a nurse practitioner, a nurse researcher, whether they're sitting on an ethics committee at a local hospital. I think the community benefits from the faculty interaction, the knowledge that the faculty can help share the research that they might conduct within the different organizations.
It's truly a win-win situation, because what we stress with our community partners, whether it's Lee Memorial Health System, whether it's NCH, is that we have a role to play and help you deliver the best quality health care that you can. And so our students, we stress them how important it is to at every chance you get, provide that quality of care within the domain of you being a student and learning to be a practitioner. But it truly is a win-win situation, and we have to focus on giving back to our community as much as possible in helping them do what it is they do in delivering healthcare.
What's ahead as you look in your crystal ball?
Yeah. Well, we have to continue to meet workforce development needs. We need to continue to produce good quality graduates, whether it's in nursing, whether it's occupational therapy, whether it's physical therapy. We have to continue to produce a practitioner that will be well placed in our community to help care for our community that we know needs it. And we'll be strategic in what we think about, or what we move towards in terms of adding new programs in the future. And that's going to be based on understanding what those workforce development needs are and what sectors of healthcare are truly needed.
Sharon, your crystal ball?
On my crystal ball, I would say that for all programs, opportunities for our graduates are increasing. Maybe different than what you read in the newspaper every day about how difficult it is for young graduates to find employment. That doesn't seem to be the case in healthcare, and it certainly doesn't seem to be the case here. There's not a week that goes by that I don't get emails from multiple recruiters in the southeast region, in the state, or even nationally for please pass this opportunity on to your students. Do you know any physical therapists that would like to come work for our organization? So there are many, many opportunities for graduates of our health professions programs.
Future for nursing.
Well, I think we've spent a lot of time the last 13, 14 years building our programs, revising our programs based on what we could see in terms of our student outcomes. And now we have an opportunity, especially with our new laboratory space, to be able to offer different types of programs. For example, nurses who've been out of nursing for a while who might need to take a refresher course. All nurses to maintain licensure must meet annual continuing education requirements. And I think it would be a good opportunity for us to be able to focus on some of those offerings that we could also make.
And does your facility afford you opportunities in that?
Oh, absolutely, definitely. Many, there are so many opportunities that we've identified we don't even know where to start first.
Crystal ball.
Well, I really see continued growth of our program. I recognize that it's not a limited growth, but it has to go along with development of faculty resources and clinical resources as well as the space that we now have. But the profession of occupational therapy is really doing very well nationally and statewide and locally. So I really see increased demand, and in fact, U.S. Department of Labor projects that really as far as they project into the future and continued growth. There are niches of practice that are developing in the profession, more and more driving evaluations, especially as baby boomers age. There are a number of conditions that can affect a person's ability to drive. Some of them are progressive and they don't really recover from those. Others, they can recover. And so as they're recovering, for example, a person who has a stroke could have impaired ability to drive because of cognitive issues, perceptual issues, let alone the motor and sensory. So full assessment of a person before they go back to driving, or for some people it's a matter of adapted mechanism hand controls for the things that we normally do that we with our feet. And so occupational therapists are really moving more and more into that. So with our new simulator, I'm hoping we can even grow continuing ed opportunities for other community therapists to come in and develop skills in those areas. So that's just one area.
Challenges that you see?
I think the biggest challenge is for us, kind of bigger picture, is continuing to meet workforce development needs. It seems like we can't produce enough nurses. We can't produce enough physical therapists. We can't produce enough occupational therapists. We can't produce enough athletic trainers, it seems. So those will be continued challenges. I think the other big challenges that are aligned with that is, of course, if we can increase our demand or increase our size of our cohorts, is now we have to increase the number of clinical sites that these students are going to learn in. And that's really, from an educational programmatic level, our biggest challenge, I think, right now.
So it's not just an unlimited,
there's
a need, therefore let's make the college bigger.
Correct. Clinical placements is the limiting factor most often in our programs.
How big a class are you graduating now? I should have checked that.
Well, they vary. It varies across programs. For example, in athletic training, they're graduating about 16 students a year. Nursing's numbers are, for BSN,
60 to 70.
60 to 70. So it does vary. Occupational therapy now is increasing its cohort and graduating about 28 a year or so.
Yes, and we're admitting 32 this year, so we expect that those, and we have a really good retention rate. We tend to retain most, if not all, students in the program. So the graduation rate is pretty much the same as the intake rate.
And for physical therapy, we made the move from the master's to the doctorate in physical therapy in the fall of 2008. And we're now part of a national application process, just as if you were going to law school or medical school. So this year we had between 400 and 450 applications for about 26 spots. So I think technology allows us to make ourselves visible in ways that we weren't before. So we are able to attract a diverse student population. I think that strengthens the whole cohort.
And
that's great.
Mitch, Linda mentioned retention. This isn't actually retention, but do graduates stay around? Do they just stay in the community?
Yeah, most of our students do. They choose to, or they'd like to. Certainly as we continue to populate our finite amount of healthcare opportunities, whether it's nursing, physical therapy, occupational therapy, our students are going to have to go elsewhere. I mean, there's only so many available positions that are open. And so as those positions begin to dry up, then students will seek to go to different regions of the state and then, of course, out of state.
Excellent. Well, thank you all for being here. Appreciate your time.
Thank you.
Thank you for joining us for this edition of FGCU Perspectives.